On Mageta Island, the healthcare journey is challenging as the illness itself. Patients brave the waters of Lake Victoria for referrals, and many a times weave through narrow island path on border in search of treatment. Mageta Health Center is the only facility serving thousands here, including fishermen crossing from Uganda.
Commodities that we have can't sustain us because like now we have workers from Uganda who have come to do fishing activity. You know, they get services from this facility. Yet in the normal population, they are not counted. So we run out of stock of the commodity.
But that influx of patients is pushing the facility to the brink, with health workers warning the high demand is draining medicine stocks and essential supplies.
As per now, we don't have a farm tech. I'm the one who is dispensing the drugs. I'm the health record. You know, I cut all across. Like now, we don't have artesunate, which is the second line treatment of malaria, because you are referring a patient just for that artesunate, yet you can do it by yourself.
He says malaria is among the leading cases alongside typhoid, diarrhea, UTIs, pneumonia, cholera and TB.
Hali ya afya si nzuri sana kulingana hii maji ndio tunatumia, na hii maji iwezi kuwa safi kwa sababu watu hata wakienda karibu hapa unaona hiyo waste inarudi kwa hiyo maji.
Walikuwa wanatumia sisi hizi maneno ya filters hizi ndogo. Hizo mandoo kama wanaweza kutumia watu wa Mageta inaweza kusaidia sisi.
Maternity care is also strained. Locals say the facility lacks adequate wards and little privacy, forcing pregnant women, new mothers and other patients to share cramped spaces.
Tunaomba ward kwa sababu hawa mama pia kama unapata mtu anazaa na pia wewe uko na shida na unaenda kwa kitanda moja na mama, hiyo ni mbaya.
For some women, the race against time ends at home delivering before they access medical care. And for severe cases, referral to the mainland remains difficult. With no ambulance stationed on the island, emergency referrals depend on the boats and improvised transport, turning every critical case into a desperate gamble for survival.
You know, apart from motorbike, there's no any other means. So you get by the time a mother gets a motorbike, already she has already delivered.
Mtu anakufa hapa, lazima tupige tu simu huko ambulance akuje. Katimba ambulance atoke huko Usenge, akuje hapa, huyo mtu amekufa.
At Siaya Sub-County Hospital in Gem, the facility serves more than 10,000 people. Evelyn Adhiambo says malaria accounts for about 43% of admissions. Beyond the malaria burden, medics are also grappling with a growing wave of respiratory infection, skin diseases and hypertension. Yet as even patients stream in seeking help, Wagai Hospital continues to struggle with critical service gaps. The facility lacks key departments including dental and radiology, forcing patients to seek diagnostic tests elsewhere.
There are some tests that we would wish to do, but we are not equipped enough to do. So there are some tests that we have to send our clients to Siaya for them. So they either go back to Siaya and come back for the treatment, or go back to Siaya and get the test plus the treatments. We have crack tests that we don't offer because at the moment we don't have those machines for that. Sickle cell tests at the moment. And then maybe also would want in future to start transfusing instead of sending clients for transfusion in Siaya.
County health officials say progress is being made. The Director of Public Health, Kennedy Odhiambo, says malaria prevalence has reduced from above 30% to 29%, while HIV infections are now in single digits. But Siaya still faces a heavy burden from communicable and non-communicable diseases, including waterborne infections, respiratory illness, and hypertension.
There's clear testimony of the progress that has been done. Like, for example, research is still on the beat of malaria, and just the introduction of the vaccine, that was a milestone. The bit that we as Siaya were able to do an IRS, that's a milestone to us.
Odhiambo warns that climate change is worsening the situation, creating fertile conditions for emerging disease vector and exposing vulnerable communities to health threats.
The entomologists, when they do their particular exercises along the shores, they'll see an increase in the number of mosquitoes or the vectors based on the fact that there are these climatic changes and the conditions that are favoring thriving of these larvae and also the vectors. So climate change is a real issue.
To improve early diagnosis, the county is relying on community health promoters in HIV care. Siaya has introduced mentor mothers to support HIV-positive pregnant women through treatment and help them deliver HIV-negative babies.
For Siaya, we even introduced graduation for these mothers. Like if you are positive, you give birth to a child, you follow all these particular laid down protocols, and the child turns negative at age 5 or even 3, we graduate you.
Siaya's health sector reflects both progress and pressure with low budgetary allocation in health sector.